Is a non-stop itching in reproductive organs a normal thing? Animal STIs, a surprising cause of green poop and being allergic to your own urine? What? Today we're diving into the medically bizarre, the oddly satisfying, and the please tell me that's normal questions you didn't know you needed answers to. No shame, no filters, just real talk from the ER side of medicine. Buckle up and let's dive right in. Is it true that all STDs come from animals? So not all, but some do have animal roots. These would be HIV, herpes. HIV came from SIV in the early 1900s, and that was due to bushmeat hunts that were occurring at the time. But then you think other ones like gonorrhea, chlamydia, HPV, these are very strictly human pathogens. When I eat a bunch of black licorice, it makes my poop green. Anyone else? Why is that?
What did we eat?
Ah, yes, it does happen. And it's a mix of food chemistry and gut physiology. So there are a bunch of natural ingredients and additives in licorice and black licorice. And there are dyes, so to speak. There's different types of coloring, like blue number 1, green number 3. So mixing these artificial colors, like the greens and the blues, with your yellowish green bile, it makes the poop greenish in color. But another reason is the speed of which it gets out of your body. There's a component of the licorice that actually acts a little bit like a laxative. It speeds up your intestinal transit time, so your body doesn't have enough time to break down some of these color components, which it normally would, thus leaving it more greenish. So because of the quick transit time, the laxative effect, you have an increased risk of hypokalemia, aka lower potassium levels. When you get low potassium levels that you poop out, you can have cardiac arrhythmias, go into cardiac arrest. So please don't overdo it with too much black licorice. And stool color that you really need to worry about, black and red. I did a whole video on stool color. Definitely check that video out. I have an odd question. Can you use an EpiPen on someone who's been poisoned?
Stick? Okay. Wrong side.
No. So an EpiPen is used mostly for anaphylactic reactions, allergic reactions that people have. We will use epinephrine in cardiac arrest individuals to try to help get their heart started, but not as a poison antidote. If you suspect poisoning, definitely call the poison control here in the United States. Or if you don't know what to do, get to the hospital. Every ER doctor is trained in these type of poisonings. And if we don't know, we will call them as well. How would I know if I am colorblind? Oh, that's a great question. So the quickest way to do it is to do the Ishihara color test. You can get these test anywhere, even online, but it's basically a dot test where there's a lot of different dots and colors, and usually there's a number or a letter hidden within those colors that are a little bit different. And so most people can pick up the object, the number in the pattern, but if you can't, so you might have a deficiency in red, green. And then there are other ways you could do it, you know, a colored pencil kit, and it usually goes from like dark to light. And so if you start noticing that a lot of the colors are almost blending together, then you may have color blindness or color deficiencies, so you need to get those checked out. Interestingly enough, 1 in 12 men and 1 in 200 women are colorblind, so that's mind-blowing. I'm gonna do a quick little test. Can you see the number? Let me know in the comments. Is a non-stop itching in reproductive organs a normal thing? So I'm assuming itching in your groin area, male or female. Is that normal? No, it's typically not normal, but it could be due to multiple different things. And this could be related to allergic reactions, yeast, most common. Sometimes you can have a bacterial infection down there. You can have cellulitis. You can also have some increased blood flow to the area, which can cause irritation. In general, our bodies should not be continuously itching, no matter where it is. Anytime you have unique itching that you feel is maybe a little bit off, definitely have somebody go take a look at it who is a healthcare professional. Wait, so we really have ribs just floating around in our body? How does that work? Great question. They're called floating ribs because they don't attach to the sternum on the front. So they attach on the back. So they're not floating around just free willy. They're in a specific area, but they don't attach to the sternum. They kind of attach up into the next one above and then above that. This is typically for ribs 11 and 12, but they do wrap around and attach to thoracic vertebrae, equivalent to the vertebrae of 11 and 12. If a cannonball is shot through your chest, but it missed all your vital organs, can you possibly survive that?
Oh, perfectly centered shot.
So, probably not, but let's go hypothetical. If it missed major blood vessels and missed your heart, if it goes through one side of your chest, it will destroy that lung. And it will destroy the vasculature, the ribs, depending on where it hits. So you're going to be in a world of hurt. But could you live with just one lung? Yes. And you're likely going to bleed out. So not really a realistic scenario, but I guess it could happen. What's the best way to deal with molting eyebrows? I personally pull them out and I find the pain to be pretty mild.
I think you look nice with no eyebrows.
Well, if your eyebrows are shedding more than usual, your first step is probably to figure out why. Is there an infection, inflammation, are the glands blocked? Also, nutrient deficiencies, iron, zinc, biotin, these also can cause hair loss as well. So a lot of different things can cause hair loss. And if you find that you might be excessively pulling them out, something potentially called trichotillomania, maybe you need to talk to your doctor or psychiatrist and get to the root of why you're doing that. Is there something like the opposite of narcolepsy? I don't sleep more than 3 hours a night, no matter how tired I am.
Did you sleep okay last night?
Great. I got a full 40 minutes.
Well, opposite of narcolepsy? No, there's not like an opposite, but there is a broader category of something called insomnia or chronic insomnia. But trying to figure out the underlying issue of why you have the inability to have long sleep is really important. It could be related to shift work, stress, anxiety, depression. Some people, though, do have the ability to sleep a very short period of time without feeling tired, but it's a rare genetic trait. So how do you go about trying to fix your sleeping pattern or treat it? And then there is some different types of cognitive behavior therapies that you can specifically do relating to insomnia. There are different types of sleep aids that are good band-aids temporarily, but even, somebody has sleep apnea. If you address the sleep apnea, say a CPAP machine, you might be able to sleep all through the night much easier. So multifactorial, a lot of different issues. You got to start knocking them off the list of what you may think that you have or don't have. But if you're interested in a supplement, my company Life Happens, doctor formulated supplements, has a product called Do Not Disturb. It has magnesium, L-theanine, passion flower to help you sleep easy, relax the muscles, and wake up refreshed. So if you're interested in it, check it out at lifehappens.com or on Amazon. A friend with a scientific interest asked, purely theoretically, what would happen to a person if they drank 2 coffees, 1 energy drink, and a can of cola?
Have you ever had a Red Bull? I never had a Red Bull before, but I had a Red Bull last night. I really like Red Bull.
That's a lot of caffeine. So you have to think about this. A cup of coffee, 8 to 12 ounces. So now you're having 2 of those. So that's anywhere between, let's just say 200 to 300 milligrams of caffeine. Add the energy drink, maybe anywhere between 150 to 200 milligrams for a normal can. And then a can of cola, which is roughly around like 40 milligrams if it's 12 ounces or so. So now we're getting close up to around maybe 500 milligrams, give or take, up or down, of caffeine in a relatively short period of time. Now, typically your max in a day should be around 400 milligrams of caffeine spread out, not all at once. So if somebody was naive to caffeine and they took this all at once, they are not going to feel good. You're going to be jittery, restless, and potentially even arrhythmias. And unfortunately, there's not much that you can do besides cardiac monitor, supportive therapies, IV fluids, and just rest, relax. Caffeine could be good in certain moments, but too much of a good thing, we always say, could end up being bad. I heard that sound has healing properties. Is that true? So that's actually a really great question. Sound has medical applications that we do use. So an ultrasound. The ultrasound uses ultrasonic waves, sound waves, to formulate an image. No radiation, but we can put it on somebody's skin and see the underlying structures. So low frequency promotes circulation and relaxation, typically used in physical therapy. And think about music in itself. It reduces anxiety, helps relax the body, lower blood pressure, actually even helps people sleep. Do you think sound has healing properties? Let me know in the comments. How come when I eat a big meal, I, for some reason, don't feel full? I can basically eat like 200 chicken nuggets and not feel full. Is that normal? Well, feeling full or satiety is really complex, relating to like your stomach, your stretch of your stomach, your gut hormones, and what the foods are that you're actually eating are made up of, like the macronutrients. But what ends up happening when you eat a big meal, you get these different types of enzymes and hormones that get released. These are all telling us to break down the food. It's also telling your hypothalamus that you've had enough. Sometimes those signals might not be working properly, so you need to get those checked. Also, maybe check the type of foods you're eating. I don't think chicken nuggets are the best thing that you should be eating, especially if they're processed. Most of them are. If you find that this is an issue that you've been aware of, definitely head to the healthcare provider so you can get checked out. My friend has had this lump on the side of his neck for the last few months, and I'm not sure what it is. Can you please tell me what it could possibly be?
Oh my God, Peter. How long have you had that thing?
I don't know.
We gotta go see Dr. Hartman right away.
Well, you need to get examined by a physician, because lumps, when people describe them, could be anything. It could be huge, it could be tiny, it could be the size of a rice grain to the size of a baseball. It just depends on who you are as an individual. So get it checked out. But things that you think about simply of lumps, you can have a sebaceous cyst, a cyst underneath the skin. You can have lymph nodes. You can have a tumor. So blood work, physical exam, maybe an ultrasound to start out with if it hasn't been identified yet, of potentially getting either a fine needle aspiration. Is it possible to be allergic to your own urine? For instance, if I hold my pee too long, I get really itchy. So no, you shouldn't be allergic to your own urine like you would be allergic to like peanuts. Those are outside sources. Your body doesn't react that way. But it could be reacting to something else, a dermatitis or an infection or even yeast. And in rare cases, people can have like autoimmune or something called mast cell activation, which can cause some irritation to your genitals as you're trying to urinate and can cause significant amount of discomfort. Feel like you always have to go, a really bad irritation to that area. So if you're having any discomfort relating to urination, this needs to be checked out. You should not have pain in this area. It should be free flowing, no problem. Like lobotomies, is there a medical procedure that you think we're going to look back on from today's medicine and think that was pretty crazy or barbaric? Nowadays, treatment of cancers where we use pretty harsh, intense chemotherapies. Maybe in the future, we'll be able to have such good technology and medications that they're so targeted that they're not causing systemic toxicity to the rest of our body. Those would be amazing. As a frontline doctor, we're not doing the research. We're using the tools that are available to us now to treat the patients of now versus the future. Really good questions. Really important to continue to ask questions and to learn more and push the envelope of, our understanding of our bodies, our minds, and where we're going in the future. So really good. If you guys enjoyed this and you want to see more, send me more questions, and definitely check out this playlist right here. Binge watch everything. And as always, please subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.